Hello, I'm Richard Nongard, and I've been the Executive Director of Peachtree Professional Education since 1994. Since that time, we've been offering licensed mental health professionals and nursing personnel approved continuing education hours to meet their professional needs. I want to take a few minutes to talk about our newest offering, which is a 30-hour approved CEU course in medical meditation and stress management. And at the completion of this 30-hour CEU course, you will receive certification as a certified medical meditation and stress management consultant. I began doing meditation with my clients early on in my professional career. Of course, some of you I've known for years, and you know that I have a background both in ministry and in counseling, with a degree in ministry in addition to degrees in counseling. And so from my own personal religious tradition, I was, of course, familiar with meditation and the benefits and the feeling of peace that meditation can bring to a person. In my very first career in inpatient psychiatry, though, in a secular treatment setting, I was taught a technique of meditation by the blue-haired nurses on that psychiatry unit in the late 1980s. And they taught me to use the principles of autogenic training to help my clients take physical control of their bodies so that they would be able to externalize their emotions, their thoughts, and their social interactions in a healthy and positive way. Now, autogenic training may sound like a fancy term, but really it simply means from within. And autogenic training, learning autogenic training, gave me a skill to teach my clients how to do something independent from therapy to help them solve problems. Of course, having come from the background that I came from with degrees and experiences in religion, and now having embarked on a path of counseling and therapy in inpatient psychiatric settings, the two topics conjointly together became fascinating to me. At the same time that I was learning these new experiences early on in my career, research had been going on the use of mindfulness-based meditation techniques in both pain management and in other areas of both behavioral and psychological medicine. The basic concept behind mindfulness meditation is a Buddhist principle. One, of course, does not have to be a Buddhist to use the meditation techniques, though, of mindfulness. And the idea behind mindfulness-based meditation or mindfulness-based stress reduction is to teach the concept of mindfulness meditation to clients so that they will be able to use the skill to pay attention to life in a particular way. Gestalt therapy talked about being in the now, and mindfulness-based stress reduction techniques are techniques that help our client to learn the concepts of acceptance and learn the concepts of experience in the now, non-judgmentally, in a way that can help them to see things from a new perspective, taking new courses of action that are both healthy to them and healthy to others. Regardless of a person's religious orientation or their religious background, the techniques of meditation, both in religious settings and in secular, and certainly in medical settings, have been researched, documented, and studied. And in the era of managed care, third-party payers, limited time and limited resources, what we're looking for are methods of therapy that impact clients that have been proven in randomized clinical trials with outcomes based on clinical research. There are four primary therapeutic modalities at this time that use mindfulness as a core or guiding principle to help clients be successful in both medical as well as behavioral health settings. These include mindfulness-based stress reduction, which originally was studied and began as a technique using the principles of mindfulness-based meditation to help people experience relief in pain management settings. Dialectical behavioral therapy has been one of the most researched and most effective treatments for the borderline personality disordered individual and for the parasuicidal individual, and it's used successfully with adults, with teens, with suicidal individuals, self-mutilators, and even the most difficult clients in psychiatric settings. ACT therapy, acceptance and commitment therapy, has proven in randomized clinical trials to again be a successful method of actually impacting clients who experience social anxiety and other anxiety disorders. And of course, the concept of mindfulness-based cognitive therapy applied to both children and adults has been used to treat a wide range of social and emotional stressors. You're going to find that our certification course will teach you the core principles and the core methods of impacting clients in a variety of different treatment settings using mindfulness-based stress reduction techniques, the techniques of dialectical behavioral therapy, acceptance and commitment therapy, and mindfulness-based cognitive therapy. The things that you're going to learn in our course come from professionally produced textbooks, such as Mindfulness-Based Treatment Approaches, A Clinician's Guide to Evidence-Based Applications, a fantastic book explaining mindfulness in plain English, as well as supplementary videos that I have produced and others have produced, including meditation techniques for the beginners, techniques of using autogenic training and using progressive muscle relaxation training in a variety of different contexts. This multimedia-based home study course can prepare you to not only internalize these techniques and use them to make your own life better, but to effectively intervene with clients in a way that's been proven in randomized clinical trials throughout our country. Now, people ask me all the time, what is the benefit to receiving certification as opposed to simply earning CEUs? Well, there are several benefits. First of all, I think it's important to seek out CEUs with meaning. It's easy to simply take an online course here or there and get your CEUs to meet your licensure hours, but earning CEUs that actually mean something to you as an individual and to your clients is a powerful way to use the resources available to you. Second of all, in the current world of third-party payers, managed care systems, state and federal agencies intervening in healthcare choices and decisions, those agencies and those institutions are looking for two things. One, qualified personnel, and individuals who know how to use the techniques that have been demonstrated to be outcome-based research techniques. The third reason why certification is important is it can help you promote accurately to clients your qualifications and the type of services that you offer, and can certainly assist you in your marketing techniques to expand both your employment opportunities within agencies and your appeal in the private practice environment. It gives you essentially an ability to relate to the world in an interdisciplinary way, to people you haven't perhaps been able to impact before, that now you will be able to effectively meet. People ask me all the time, how long does certification take? And it's designed to be a 30-hour CEU program, both in textbook form and with the supplemental video materials. A person studying 1 hour a day could easily complete this program in about 6 weeks. This is a life-changing opportunity for you. It's something that not only will benefit you personally by giving you new skills, but it's something that will truly help the clients in their caseload, regardless of what type of medical or behavioral health setting you're working in. If you'd like to go ahead and take the next step and actually learn how to use techniques that have been proven in clinical environments to be valid techniques to truly impact clients, complete our program. And when you complete the program, you'll find that it was time well spent and CEUs with meaning.